Good morning. I'm Dr. Ara Deuk, CEO and founder of Deuk Spine Institute. I'm here with one of my lovely patients who had surgery about a week ago. And I'm just going to tell you briefly about her story, and then I'll let her give you more details. She has a condition that is not common. It is a disc herniation, basically a disc bulge, which is a small herniation. And it was in the thoracic spine at T11-12. Mm-hmm. And this patient was suffering for how long?
Oh, I would say 3 or 4 months.
3 or 4 months.
Mm-hmm.
So she had pain for months, and I'm going to let her tell you how she went to her doctors and what they told her. But in the end, it turned out to be a small herniated disc, bulging disc with an annular tear causing all the pain, and it was wrapping around her ribs. So why don't you tell us about what brought you to Deuk Spine Institute in the first place?
Brought me in the first place. Well, I went to some other doctors. They did MRIs on this area, told me it was a kidney. And then they said, well, you only have a small cyst on the kidney, that couldn't be the problem. Oh, well, maybe it's your stomach. Well, maybe it's your, I went through all kinds of stuff. And all kinds of tests,
Misdiagnosed.
Misdiagnosed. I mean, probably 4 or 5 different things misdiagnosed. I had been here before for another for some shots in my back, because I had a fall a few years ago. But anyway, but this pain got so bad, it was starting here in my back.
Can you show the audience where it was?
Sure, it was right here.
Right in the thoracic?
Right in this area, and then wrapping right around here. And so it was the whole area. And
around your ribs.
Yeah, you can almost not tell whether this pain was coming from here or from here, because it was hurting all the way around. So I came here, they did an MRI here, and they said you need some laser surgery done on T11 and T12. Well, I came in, and in the meantime broke my foot while I was getting this done.
But not here.
No, you didn't do that, didn't you? And anyway, so I came in, and it was just a week ago, a week and a day or so ago, and got this done.
The Deuk laser disc repair, endoscopic surgery. I repaired your tear and your bulge. And we broadcasted that, I believe, right?
Did you?
Yeah,
okay.
so it's out there.
And within a couple of days, I had a little bit of soreness, of course, and little aching here and there. But now I've had no pain at all. Haven't had any now for about a week, almost a week. I haven't had any pain at all here. So I'm really happy that I know this man, that he fixed me, because, I mean, that pain was excruciating.
Yeah.
You'd just be bending over with the pain. So, and almost made you feel sick to your stomach because it was so bad. So
no way to live life.
No, you'd have to take painkillers every single day just to get up and move.
Is that what you were doing?
I was doing that.
Yeah.
I was taking OxyContin and acetaminophen mixed with it. Percocet, I guess what they call it.
And do painkillers work to cure the pain for you?
They help some. They didn't totally get rid of it.
They don't get rid of it.
No, not totally get rid of it. No.
They don't. I mean, I agree with you, and that's the problem with painkillers, is they don't get rid of the pain. The only way the pain's going to go away is if your body actually heals the injury. The injury is the herniated disc in this case.
Right.
And that's what we're here talking about, is how can you heal a herniated disc? The reality is most people heal their herniated disc and they have no pain and symptoms. In your case, though, and there's about 5% of people with herniated discs where they continue to have pain and symptoms, whether it's in their lower back, mid-back, neck, and it can radiate down in the arms or legs, and they just can't heal their disc to where the symptoms go away. And that's where the Deuk laser disc repair procedure is really the only one in the world that we go in and we can find the tear and repair it with a laser. And we were the first to do it. So you had a thoracic herniated disc, and that's special because 99.9% of the patients that come here that have pain is in their neck or their lower back, but rarely do we see thoracic disc herniations that actually cause pain. It's uncommon. And in the past, the only way to treat that was to do a big surgery where we would have to remove part of the rib
Oh my,
And then we would have to come from the side, and we'd have to take the disc out and put a cage in there,
wow.
and then put screws and rods and fuse. And then a doctor in Arizona developed a transthoracic endoscopic surgery where you drop the lung, you need a cardiothoracic surgeon, it's done in the hospital, but he goes in endoscopically from the side, kind of from the front approach. Very, very good procedure, but very invasive. And then what I did for you is I did it outpatient, right? And it took an hour to do, and we went just from the back to the side a little bit.
Right.
And your anatomy was perfect. There was a nice gap between the rib heads and the ribs. I was able to get into your disc space through the muscle and enter perfectly. There was no problems with the spinal cord, no problems with the nerve roots, no problems with the lung. And everything went perfectly under propofol sedation. And here you are a week later, and it's your pain in the thoracic and your thoracic radiculopathy or rib pain is completely gone.
Right.
So it's an amazing surgery. It's the least invasive in the world for this problem, and you're living testament that it works. Now, I've only done 2 thoracic disc herniations with the Deuk laser disc repair procedure in my entire career of 22 years. You're the second one, yeah. Yeah, I've done a lot of laser surgery on disc, but
Well, you won't
thoracic.
forget me ever, right?
No, that's
Okay.
why we're doing this.
Right.
It's because it is special.
Right.
It's very uncommon to have a symptomatic thoracic disc herniation because the thoracic disc herniations are stabilized by the rib cage, and so you don't get much movement, so it's rare. So, making the right diagnosis was important, and we did that here at Duke Spine Institute. Now, did you try some conservative treatment first? Some shots?
Oh, yeah, physical therapy some, and, heat and some, well, Dr. Patel did a shot, but it wasn't for that. Because I had several problems I've had in my back and my neck from accidents and things. But he had given me a shot, but it wasn't for that. When I finally went to look for that, I was just trying to figure out who could figure out what it was,
Yeah, and we figured it out.
That's a problem.
And so what were the other doctors telling you at the end when it wasn't your kidney, your stomach?
I haven't talked to him yet. I should go talk to him all, shouldn't I?
Yeah, let them know, let them know.
Yeah, right.
But, this highlights a very important point in treating spinal conditions. Honest to God, 99% of doctors treating spinal conditions cannot make the right diagnosis. They don't know. And they're doing their best, but they don't have the experience or they don't have the tools to be able to make that determination. And what we have here at Duke Spine Institute is we literally have the most advanced equipment and we have the most advanced techniques in the world. And that's because Dr. Patel is wonderful at interventional procedures, and he helps me figure out where pain comes from. And then I go in there and I treat it. I can treat it with the laser surgery. So thank you for spending the time. What are you going to do now that your pain is gone? How does that change your life? How does that help you?
I can take care of my 90-year-old mother better now. She's with me right now.
That's important.
So I can take care of her much better, and I can start taking care of the dog, and my husband won't have to do all that stuff anymore.
All right.
Because he's had to take over a few things. But
Yeah.
But I really need to take care of her. That's a big thing for me.
It lets you get back to doing what you want to do.
And I'm going to bring her in here fairly shortly too, because she's having some pain. So I said, well, I know where to take you. So.
Thank you. Thank you. Well, it's great to see you, and thanks for coming in. And go enjoy yourself. And you know where to find us if you need us.
I'll give you a call, I'm sure.
All right. Thank you.
Okay. All right. Thanks.